Hello, I'm Dr. Fox. Today, I'd like to talk about all age blood groups. Rh factor is a protein that is sometimes found on the surface of red blood cells. The majority of human beings have it, but some don't. Whether you are positive or negative for Rh factor is dependent on the way you received your genes from your parents. If at least one parent is Rh positive, the baby can be either. If both parents are Rh negative, then the baby will be too. All pregnant women have tests to check whether or not they are Rh positive or negative as part of the standard blood work your doctors will do at an early stage of pregnancy. Okay then, what if one parent is negative and one is positive? If one parent is negative and one parent is positive for Rh factor, we call this Rh incompatibility. An example would be if the mother is Rh negative and the father is Rh positive. The fetus might inherit Rh positive blood from the father, and this happens in about 50% of these cases. Rh incompatibility generally doesn't cause any problems in the first pregnancy because usually blood from the fetus doesn't get into the mother's bloodstream. However, mother and the baby can mix blood when the baby is being born. If this is the case, then the mother's body identifies Rh protein as being something that shouldn't be there, and it might start creating antibodies, which is proteins that protect us against attack from viruses and other illnesses to attack the Rh protein. There are other ways that Rh negative women might be exposed to Rh protein that can make their bodies start producing antibodies. These include being given a blood transfusion of Rh positive blood, having a miscarriage, or suffering an ectopic pregnancy. Okay, next, why is Rh factor important in pregnancy? There can be difficulties if a mother is Rh negative but her baby is Rh positive. If the mother naturally doesn't have the protein in her body, her immune system thinks that it is an invader and could cause harm. If she gets Rh positive blood in her system because cells from the fetus can enter her system in the course of pregnancy or when giving birth, her immune system will create antibodies to attack the protein. If this happens, the mother is called Rh sensitized. Most often, this won't happen in the first pregnancy until the mother gives birth. What we have to worry about is any following pregnancies. Okay then, what do Rh antibodies do to the fetus? If a mother becomes Rh sensitized, the antibodies she creates can pass through the placenta and into the bloodstream of the fetus. These antibodies then can attack the fetus blood cells, causing fetal anemia. Because blood cells transport oxygen around the body, this can be a serious matter. Okay, next, can we prevent Rh sensitization? If your blood is Rh negative and you haven't produced antibodies for Rh factor, your doctor will give you an injection of Rh immunoglobulin when you're about 28 weeks pregnant. For 99% of mothers, this stops them becoming Rh sensitized, so if your baby's Rh factor cells get into your bloodstream, your body won't attack them with antibodies. This injection may be needed if you bleed from the vagina during your pregnancy or if you need amniocentesis. If your baby is Rh positive, you'll be given another shot within 3 days of giving birth. Lastly, if you test Rh negative, the father of your baby can take a test for Rh status. If he's Rh negative as well, then you won't need any treatment. Additionally, a cell-free DNA test can be taken using your blood to show if your baby is Rh negative or not. If she is, you don't need any treatment. Okay, then lastly, what happens if you are Rh sensitized? If test shows that you are Rh sensitized, your baby will be regularly tested to see the effect Rh disease is having on her. Sometimes no treatment will be needed. However, sometimes it might be best for a baby to be delivered early so that the Rh disease can be treated outside the womb. If the Rh disease is particularly serious and the baby is too young to be delivered early, they can be given a blood transfusion while still in the womb, but this is a very uncommon procedure. Okay, thank you for watching. See you soon.